Someone's fallen off a horse.
This man has already had 4 units of blood.
Landing on his right side, about a 1.5 metre fall.
We're worried about bleeding within the abdomen.
Don't move your arm, mate. Don't move your arm.
That would have hurt a little bit.
I'll get you something for the pain, all right?
We're going to figure out what's needed to stop the bleeding.
On the hospital roof, an air ambulance is touching down with Dr Jonathan and Dr Emma's critically injured patient. Construction site manager Stephen was at a country property when his horse reared up and threw him from the saddle.
Abdo pain, blood pressure's very low.
Okay, and they're already having blood.
Yeah. So we might be in a whole lot of trouble.
For the helicopter guys to be using blood already and to have a low blood pressure, despite that, that's really serious. He could bleed so much that by the time he arrives, he's got no pulse, he's unconscious, and we've got minutes to reverse that, otherwise he's dead.
All right, here they come. Hi, Sam. My name's Emma. I'm one of the emergency doctors. We'll get you across and we'll look after you, OK? Just sing out if you need something.
Sorry about this there. 1, 2, 3.
OK, folks, we've got Stephen here. He's climbed onto a horse this morning with no helmet. The horse is standing still, but it's gone one way and he's gone the other, landing on his right side on quite hard ground, so about a 1.5 metre fall. Very, very tender down to the pelvic area across the right pelvis. Blood pressure's really not improved. And that unit of blood we've got up there is the 4th unit of blood he's had.
OK, thanks very much.
We'll get you something for the pain, all right, buddy?
Stephen has had a lot of blood before he got to hospital.
Just don't move your arm, mate. Don't move your arm.
Most people would have responded to 1 unit. He's had 4 units. That's getting very serious. He's hosing somewhere.
I'm going to put a Rick line in there.
Yeah.
It's vital doctors replace the huge amounts of blood the father of 2 is losing.
I'll just put a big drip in your side, mate. Sorry, that was sore.
In a critically unwell patient, we need to give them blood quickly. And one of the easiest ways to do it is just to put a Rick line in, which is a rapid infusion catheter. It's a nice wide bore line, so with a big diameter, we'll get the blood in quicker. It's a bigger hose.
OK, you got a Rick line.
Wonderful, good.
That would have hurt a little bit.
Emergency nurse Elle Greenwood explains to Stephen what's happening.
So what we're doing at the moment, which you can feel, we're just putting a needle in your arm for blood. Because you've got a bit of a bleed in your tummy.
Did you get anything on ultrasound?
Yes, there's an unusual amount of blood in the pelvis.
Yeah, OK.
With our ultrasound machine, we found that Stephen is bleeding in his abdomen. It's either coming from his pelvis or his liver or the spleen.
OK, everybody, we're going to get a pelvic X-ray. If you don't have lead, just pop out for a sec.
If Stephen has a fractured pelvis, it can open up, and as it opens up, it tears a whole lot of vessels. They can bleed tremendously fast, and unless the bleeding stops, he can bleed to death.
Sit down, watch a TV show.
Down the corridor, nurse Sarah Thomas and emergency doctor Michelle Thornhill are discussing hair braiding.
How long does it take?
Oh, about 3 hours.
Oh my goodness.
It's not that bad. I like getting my hair done because once it's done, it's set it and forget it.
How often do you have to get it done?
Oh, like this will last probably about 6 weeks.
Oh,
before
so
I can get
ages.
it. Yeah.
Where is everybody?
Royal Melbourne receiving.
G'day, Royal Melbourne. We're in Parramatta with a 21-year-old male who's riding motorcycle has gone into a car.
At the control desk, a call has come in from paramedics bringing in a badly injured young motorcyclist.
Thanks, Mike 14. We'll see you then. Over.
21-year-old Chippy Adam was riding to work when he collided with a car.
Okay, I'll go.
Dr. Michelle has personal experience of the carnage motorbikes can cause.
I grew up knowing that my father's brother died as a result of a motorbike accident, and I can't imagine anyone else going through something like that. It was quite traumatic and distressing. So all I know so far is a 21-year-old man who was driving a motorbike and crashed it into a car. They think he's broken both of his arms. Ah, here we go.
Hello.
Hello.
How you doing?
Good, thanks.
I'm Sarah, one of the nurses.
Welcome, I'm Michelle from Emergency Doctors. Hi. So guys, if you're happy, we'll get him across.
This is Adam. Essentially, he's run into a car. Bystander says that he's going straight off the handlebars, and all I can find is the bilateral broken arms. Head, chest, abdo, pelvis, left and right leg are all intact.
So Adam has hit a car and basically goes flying over the handlebars. I picture with both hands out like a Superman moment, and then landed, injuring both his wrists.
Watch my arm, please.
From the minute you break a bone, that outer lining that covers the bone is filled with nerves and nerve endings, and it can be excruciatingly painful. Sorry.
Adam's had some pain relief, but Dr. Michelle needs him to remain conscious to monitor him for any signs of head injury.
On a pain scale of 1 to 10, a broken bone is definitely up there as a 10.
Adam's broken wrists will put his job as a carpenter in serious jeopardy.
Mom,
Yeah, they are. But that's okay. Nothing we can't fix.
how am I gonna do push-ups?
How are you going to do push-ups? You won't be doing push-ups for a little while, my friend. I'd be more worried about how you're going to wipe your bum.
I'm just going to have to move your arm up or down a little bit. What do you think is going to be easier?
The ultrasound and chest x-ray don't show any obvious internal injuries.
So it's just that right wrist, and then we'll undo this one and see. Sorry. When we took Adam's bandages off, we could see that both of his wrists were obviously broken, and they were both quite deformed and both badly dislocated.
Am I hurting you?
Yeah, just a bit.
Sorry, mate.
With wrists that are broken and quite deformed, it can put pressure on the nerves and the blood vessels in the area. So you run the risk of cutting off your blood supply, or worst case scenario would be a spread of that infection and potentially death.
Okay, nice and still, mate. You're doing really, really well. Have we gotten pain relief coming, Emma?
Pain relief's
Oh,
coming.
thanks, Ab.
In Royal Melbourne Emergency, 61-year-old Steve has massive internal bleeding after being thrown from a horse.
Can I get that pelvis x-ray and then we can get a couple more blood pressures?
As his two adult sons rush to be with him, senior emergency doctors Emma West and Jonathan Papson wait on Stephen's x-ray results.
Okay, let's have a look at that x-ray. Okay. All right, everyone, it looks like we've got an open book pelvis injury. Our initial x-rays show that force of falling high down onto the ground has opened up his pelvis, and it's likely that he's bleeding from major vessels in there. It's a really significant injury and he's critically unwell. He's in a lot of pain.
Yeah, he's pretty sore.
Steve, we think you've got a broken pelvis and that's what's causing all the pain. That's where you're sore, isn't it? Yeah. So we're going to go to a CAT scan and then we're going to figure out what's needed to stop the bleeding that has probably been going on, and that's why you feel so awful.
Stephen told paramedics that when he fell, he felt a crunch followed by a warm sensation and swelling in his stomach.
One of the things you can see late in trauma is people start to swell up because you can hold 6, 10, 8 litres in there. It is amazing how much blood volume can be held in the abdomen of someone.
Getting Stephen to the CT scanner is crucial so doctors can see exactly where he's bleeding from. The problem is he's still bleeding and has to be stabilised.
We're giving unit after unit after unit, just trying to support his circulation. We're up to 10 units of blood for Stephen, and that's almost replaced his whole circulating volume. So he's bleeding significantly.
Jonathan, if you've got a free hand, could you cycle that blood pressure again for me, please?
You wanted to cycle and maybe make it 5 minute there.
By the time you get to 10 units, we call it a massive transfusion. That's the real deal as far as transfusion goes. We're pouring blood in and he's losing blood out. So it's more of a, pouring into the bucket and there's a hole in the bottom of the bucket. So it doesn't matter how much we put in if we haven't plug the hole.
We'll see what the next blood pressure is. Oh, good, perfect.
Suddenly, Stephen's blood pressure improves and Dr Emma decides to get moving.
Everybody, we're going to go to CT. So I've got transport kit, got EDA, we've got our blood and everything coming with us.
Stephen is extremely unwell. His blood pressure is low. It's at a level where I can get him to the CT scanner, but it's pretty touch and go. I need to be with him at all times, and I need to have all the blood products on hand to be able to continue to resuscitate him. So I can't leave him, not even for a second.
Stephen, what this is all about is just really try and find out where the bleeding is, okay?
There's a very high mortality with a broken pelvis because every lost minute he's losing more blood and potentially his mortality is actually going up. I've seen it happen. The longer you wait with a broken pelvis, the riskier and more dangerous it gets for the patient.
Yeah, it's gonna hurt, mate.
Back in Trauma Bay 1, 21-year-old Chippy Adam has badly broken wrists after he was thrown from his motorbike in a crash.
You'll be out of action for a little while. You'll be in casts for a while and probably need rehab.
Adam's x-rays show his wrists are severely bent out of shape, and Dr Michelle's concerned if they get infected, the injuries could be fatal.
Okay, so Adam, I've seen the x-ray. We really need to get your wrist back into the proper position and put a cast on. That's exactly what we're going to do, okay? To get the wrist back into position, it can take quite some force and it can be excruciatingly painful, which is why we usually put people to sleep. Have you ever had any surgery before?
I think in my right hand, yeah.
Did you break that before?
No, I shot it with a nail.
You shot your right hand with a nail?
At work.
Okay.
Not on purpose.
Yeah. Okay. We'll do some sedation and see if we can fix both of them at the same time. Yeah, okay.
Pulling both wrists back into place at the same time is a big job. So Dr Michelle's called in extra help from the orthopaedic team.
We get one person to hold the arm higher up, and then the other person focuses on the wrist itself and the hand. Sometimes you need to exaggerate the deformity, so pull it back and then use a lot of force to bring it over and get it down so that it lines up nicely like it did before.
We're gonna put you to sleep. Where's your favourite place?
The gym.
Okay, maybe anywhere else? Like a beach?
No, I like the gym.
All right, pretend you're at the gym.
You guys are ready to go?
Yeah.
All right, so you're just getting a bit more pain relief here now. Deep breaths, that's the way. I give him the medication. I wait till he just nods off and doesn't respond to me anymore. You all right, Adam? And that's my cue to tell the others to go ahead. Yeah, all right, you know, get started. I'll give him some more if necessary.
Oh, no.
Deep breath for
It's okay, mate.
Even though Adam looks like he's distressed and in pain, he's actually not aware of what's happening.
It's like, put your head down. Head down.
It can be quite disconcerting to see someone look like they're in pain. But after doing this for several years, I've come to realize that it's almost a dream for him. Oh, good, we're done. Once the wrists have been realigned, the next stage is to immobilize them. We put a hard plaster of Paris on, so it protects Adam from moving the wrists around, which could potentially cause the broken fragments to slip out of place again.
Itchy.
Itchy, your nose.
Ah.
No.
We'll do that for you.
There
you go.
There you go.
There you go. I
That's
know
better.
the nose gets
There
a
we
bit
go.
itchy with the medicine.
There you go, under your chin. There you go. No.
All done, Adam, okay?
Okay.
Adam's broken wrist is totally going to change his life for at least the next 2 months.
He's just knocked me out already.
It's all done. Your hands are plastered and they've been pulled.
Oh, nice.
He'd be in cast for up to 6 weeks.
Am I all right? Am I going to live?
Yeah, you're gonna live.
Yeah, then it's all right.
He usually works with his hands, so he'll be off work. No carpenter work for him for now.
You don't remember us putting you to sleep and pulling both your arms?
I remember sleeping,
That's good. Yeah, because it wouldn't have been very nice.
Eating's gonna be a challenge, showering's definitely gonna be a challenge. So he'll need a lot of support from his family to help him get through this challenging time.
Does anybody know you're here?
I don't want anybody to know I'm here.
Why?
No one knows I have a bike.
Where do you keep your bike if they don't know you've got a bike? Don't move your head. Don't move your head. You leave it at your cousin's house.
No good.
No good. You're living with mum and dad and you've got both of your arms broken. You're going to need their help. How about maybe we ring mum then?
She'll get worried.
She's going to be more worried if you don't come home and she doesn't know where you are.
I usually get home late, but...
Look, I don't have to tell anybody you're here if you don't want me to, but I would strongly advise you to call your mum or your dad.
They told me not to ride it, that's why.
I still think you should call your mum. I'll talk to you a bit more when you wake up, when you're a bit more awake, okay?
Well, this is what I'm going to ask. I'm just a bit on edge now.
It seems to be a day in emergency where adult children are causing great anxiety for their parents.
How are you doing? My name's Luke, I'm one of the emergency doctors. And this is your mum and dad, yeah?
Yep.
Okay. And what brings you in today, do you remember?
I had a seizure, but I don't remember how.
Okay. Have you ever had a seizure before?
No, I've never had one.
Dr Luke de la Rue's patient, Eleni, was brought in by paramedics after having a seizure in front of her terrified parents.
I made a squeal and then I went up to her and she was convulsing.
What did you notice?
Her eyes were flickering, then I noticed her legs were stiff. Yeah.
Vomiting as well.
She was vomiting.
She was vomiting as well.
Yeah.
And how long do you think the seizure activity lasted for?
For me, I think it was, I looked at the time, 10 minutes.
Seeing someone have a seizure is really distressing because they have no control over their body. Her parents saw their daughter have this uncontrolled shaking. She was unresponsive. It looks as if they're not breathing. And there's nothing that you can do other than sit with them. And even if it is often just a couple of minutes, it often feels like a lifetime for the people who are witnessing it. And it is really, really scary watching your loved one go through something like that.
Just seeing that stare in the space and there's no communication. You're just wondering if they're going to come respond back to you. Yeah.
Any family history of any seizures or seizure disorders?
My brother had a stroke.
Had a stroke?
Yeah. And after that he had seizures.
Okay, after the stroke.
That's why I thought she was having a stroke when I...
Fair enough, yeah. It can be pretty scary to see someone having a seizure.
I tried to stay calm, but...
It's a horrible thing to have to watch their loved one go through, yeah.
She didn't know where she was.
Yeah.
She can't even remember.
Dr Luke needs to assess if Eleni's seizure's been caused by something she's been doing.
And you haven't bumped your head or anything recently? No trauma. Do you use your phone a lot at night or flashing lights or anything like that?
I usually use I have a light on when I'm using my phone.
Okay. So in the last few days, you've been otherwise feeling fine?
Yeah, I've been working, so...
What do you do for work?
I work at office work.
Okay. And how old are you? Just remind me.
20.
20. In the last, over the weekend or anything, you haven't had a big night out or anything like that?
When did I last go out? I think, did I go out last week?
You've been out just about every weekend.
Yeah.
Okay.
Yeah, she works 5 days and
Yes.
then goes out.
Did you drink a lot on the weekend?
Yeah.
I drank a little bit.
Yeah.
Yeah. Okay.
Yeah.
But only on the
shots.
weekends? Just on the weekends usually? Or?
Yeah, just on the weekend.
Okay, fair enough.
We've been a bit concerned with working, studying, and not studying up to late hours. And
fair enough, yeah. What are you studying at the moment?
We've been saying
You're studying law?
Right.
Okay. Yeah, it's a lot to take on. Yeah.
Eleni's seizure today is probably a lot more distressing for her parents than for her. They've Googled seizure on the way into the emergency department and they're thinking in their mind, she's got meningitis, she's got a brain tumour. Because they are really worried that she might go on to develop epilepsy or have further seizures.
We did a small reno when we first moved in, kind of just give us an extra bathroom.
Emergency Doctor George Plunkett's first job out of medical school was at the Royal Melbourne, and he's worked here for 15 years.
I'm not really a huge, renovation fan.
His passion is medicine, not DIY.
Oh, good Lord, no. No, I pay other people to do that. I'm also acutely aware of the capacity that I would have to injure myself spectacularly. So me, heights, power tools, nah. I'd prefer not to be a patient in my own hospital.
Dr. George's next patient, arriving by air ambulance, is a home handyman. 71-year-old George was helping a mate reno his garage roof when he fell through the ceiling, hitting his head on a washing machine and injuring his neck.
Sounds like you'll have a decently high C-spine injury. He's got no sensation below arms. At this point in time, George is a quadriplegic. He can't move his arms, he can't move his legs. So I'm extremely worried for him.
Paramedics have reported George has dangerously low blood pressure.
The problem with George having a low blood pressure is either he's got garden variety shock from trauma. You know, he's fallen from height. That's the first concern. The second concern is that he's got something called spinal shock. If you disrupt your spinal cord in the neck, then there's a reasonable chance that you've disrupted the nerves that would normally be controlling things like our blood pressure and our heart rate. And those people can get extremely sick pretty quickly. Okay, cool. First off, do we have some NORAD good to go? Looks like we do. Excellent.
Dr. George has rounded up a big trauma team to tackle any problems George may have with his heart or his breathing.
From the moment I first saw George being wheeled past me in the emergency department, even as he's going past me, I can see, thankfully, he was able to breathe. So everybody, we'll get him over onto our bed first.
1, 2, 3. Here we are.
This is George. He's normally sitting well. He's been working in a garage. He's stepped forward onto a piece of plasterboard and he's simply fallen straight through. Just concrete. However, just beside it was a washing machine, which it appears that he's impacted the top of his head on. When the first ambulance crews arrived, they found him in the fetal position. He's had nil sensation or strength from essentially the point below his shoulders.
Okay. Hello, George. I'm George. Congratulations, you've got an awesome name. Now, we're going to get you around for some CTs soon so we can work out what your injuries are. And then we can try and work out, once we know what your injuries are, what we're going to do about them, okay?
George's wife and son are on their way to the hospital.
What I'm worried about with George is, you know, he's not 20 years old anymore. The older we get, the less well we bounce back from these things. So we'll get you a bit more information as soon as possible. The other worry I've got is that if he's got a high spinal injury, he could be left at the end of this a quadriplegic for the rest of his life.
Do you want the next bag of blood?
We'll just hold there because hopefully we'll get this scan done.
In Royal Melbourne Emergency, the situation is critical for 61-year-old Stephen, who's had 10 units of blood but is still bleeding internally.
Right, Stephen, we'll just get that scan done and we'll be back with you in a sec.
Emergency doctors Emma West and Jonathan Papson hope a CT scan will pinpoint where the bleeding's coming from.
What's that? There's all... So that's all blood there.
Well, yeah, he's bleeding.
That's all haematoma in there.
The CT scan has shown us the pelvis is very opened up at the front. There's broken bones at the back as well.
Rest your arm over your belly for me, Steve. That's the one. Good man.
And more importantly, there's significant haematoma or blood clot and bleeding in and around the pelvis.
I'm just having a peek in your undies because you look like you're quite swollen within your testicle area. You feel sore down there?
The CT scan is also showing us there's a lot of bleeding going down into the scrotum and penile area, and that there is a bleeding vessel down there that is likely responsible for the ongoing bleeding within Stephen's pelvis.
Okay, it's really sore down in the front of your tummy, isn't it? Yeah.
So now we know exactly where the blood is coming from, and the idea will be shoot a whole lot of gel foam into his arteries, block them so that they don't bleed anymore. That's how we treat bleeding trauma in the pelvis.
As his sons make their way to the hospital, Stephen's returned to the trauma bay to wait for urgent surgery.
The urologists, so the kidney and bladder doctors are also going to come and meet you because they're just a little bit worried that you might have a bladder injury. They go together, this pelvis injury and the bladder injury, okay?
just keeps on getting better.
Yes, I know, it must be awful.
Got any good news?
There's actually a lot of good news. This part of your body is perfect.
The bottom's wrecked.
The top part's perfect.
No, if you want to get on a horse, there's some of the risks on it.
Yeah.
Barely an hour ago, Stephen was dangerously close to losing his life.
In a way, Stephen's lucky he's got an open book pelvic fracture because it's one of the ones that responds best to the treatments we can offer in emergency and later on. So Stephen's lucky he's got that. He's not lucky, obviously, he's got a broken pelvis falling off the horse.
Okay, Stephen, your two sons are here. Would you like them to come in?
Yeah.
Yeah, you're happy with that? Come through, that's fine.
Sorry for a minute. What have you done, man? How are you feeling? Yeah?
Just took off and headed down towards the water and then shied off. And I just went back straight over.
Reflecting back on that initial call, hearing that Stephen had fallen from a horse and was getting multiple units of blood, really I thought there's a real chance that he might die on the way here.
And do you ride horses?
He doesn't get it, eh?
Ah.
Not anymore.
Yeah, I was going to say.
Being with him now, with him and his family, and seeing that he's relatively stable is just so rewarding. You know, this is why we have trauma systems and healthcare. You know, it's what makes the difference. It's what keeps people alive.
You will feel kind of washed out and lethargic for a little while because essentially it's like running a marathon, so your whole body has been shaking for like up to 10 minutes, so you'll feel pretty wrecked.
Down the hallway is 20-year-old law student Eleni, who had a 10-minute seizure in front of her frightened parents.
It was very scary. You don't want to experience stuff like that with anyone, let alone your own child.
All right, so I'm just going to do a quick examination just to test a few different things.
Dr Luke Delarue is assessing if Eleni's seizure was caused by stress or if she suffered brain damage.
Okay, how many fingers over here?
2.
Down here?
1.
You can have seizures because of bleeding on the brain, because of tumours on the brain. It could be an abscess or a focus of infection within the brain. It could be due to bleeding in the brain. So a whole number of different things.
Can you feel this?
Yeah.
Same on both sides?
Yeah.
To check if Eleni has any brain abnormalities,
Can you hear this?
Yeah.
And this?
Dr Luke puts her through a series of tests.
Just want you to look straight here.
Yeah.
We're looking for a problem with the nerve function that might point us to a problem in the brain, things like drooping of the face or inability to speak.
Big smile for me. Good, and blow your cheeks out like you're blowing up a balloon. Good, and relax.
We're also looking for a weakness or the inability to use an arm.
Just squeeze my hands hard as you can. Pull me towards you. Push me away.
To assess the function of the back part of her brain.
Just with your hands like this, go like that.
I asked Eleni to rotate her hands rapidly.
Backwards and forwards fast as you can.
If that part of the brain was not working properly, then she would have a lack of coordination, so she would have difficulty moving one hand above the other.
Good. Move your right index finger up. Touch your nose. Touch my finger. Backwards and forwards fast as you can.
Eleni passes the tests, but the cause of her seizure is still a mystery.
She felt she had a migraine coming on before having the seizure. So with headache plus seizure, we worry more about things like bleeding on the brain or tumours, and so we need to make sure that she has a CT scan as soon as we can.
Will you get the results today?
Yeah, so we'll get the results of the CT scan, and the blood test shouldn't take too long as well. Yeah.
20-year-old law student Eleni and her worried parents are hoping a brain scan will uncover the cause of her first seizure.
Okay, this is about now to see if she will develop epilepsy.
Yeah.
Is that what you're looking at?
So they're just basically looking for anything in the brain that might indicate that this is epilepsy or that she's at increased risk of further seizures.
Eleni's parents are really worried that she might go on to develop epilepsy because seizure disorders are very, very common. In the general population, up to 3% of people will have a seizure in their lifetime, and potentially up to 10% of those may go on to develop epilepsy.
Okay, so they're just still looking at it at the moment. There's just some information here about the first seizure, essentially.
Seizures are life-changing and potentially fatal. Dr Luke gives Eleni a list of do's and don'ts so she doesn't endanger herself or others.
For the next 6 months, the best thing you can do is avoid those things that would put you at risk potentially if you would have a seizure. So baths, swimming, even riding a bicycle or something like that.
If Eleni was in the bath and had a seizure and she was by herself, then that puts her at risk of drowning.
Make sure you got adequate sleep, adequately hydrated, reduce your screen time, especially at night.
Be going out like with my friends.
You want to kind of limit that a little bit, yeah, because there's potential for that to contribute as well.
I think for someone who's in their early 20s, hearing this news is a huge deal. Not burning the candle at both ends, making sure you limit your alcohol intake and reduce your binging. I think Eleni was a bit shocked by that.
So my concern is now, like I was there today, but if she's on her own, she is going to be on her own.
Yeah.
Even at work, like, I climb ladders and stuff, so I don't think I'll be able to do that as well.
Yeah.
Okay.
Okay.
Have a look at the CT.
Yeah, so as soon as the CT scan, hopefully it'll be in the next 20, 30 minutes. I know it's been a long time.
Okay.
Okay?
Thank you.
As Eleni comes to terms with her new lifestyle restrictions, Dr. Luke finally has the results of her brain scan.
Right. Okay, so it all looks fine.
Oh, is it?
Yeah.
Oh, God. Oh, God, I've been crying.
It's worth the wait. Oh.
Fine, yeah. I know it's a lot to take in. Everything looks fine, okay? So nothing to worry about, okay?
It's always a lot nicer to give good news than bad. And I guess, in the course of a busy day, you kind of take that as a small win.
So the scan doesn't show anything abnormal at all. So we just follow through with the plan as we went through before, okay? All right.
Thanks.
That's all right.
Thank you
so much.
Oh, yeah. Okay. Oh, my God. It's too long. I don't know.
They're going to check you out from head to toe and we're going to get some scans.
The situation hasn't improved for 71-year-old George, who can't move after falling through a ceiling.
Does someone know you're here? You're next of kin?
Yeah, my wife and their mum, their wife.
They're on their way. Okay.
How's your pain going?
Right.
Yeah. If your pain gets bad, sing out, don't be brave.
Emergency Dr. George Plunkett fears George is paralysed from the neck down because of damage to the upper part of his spinal cord.
The way George struck his head on the way down makes me really worried that his head's moved in a slightly different direction to the rest of his torso and kind of stretched or crushed a bit of his spine. George, I'll be honest, I'm a bit worried about your neck. I think you're probably worried about that as well. I often am in the situation giving devastating news. I personally think that there's no point in giving somebody information that they know is just wrong. I'm talking to George. He can't move his arms or legs. He can't feel them. He knows that he's given himself a nasty spinal cord injury. And the sooner I can find out what the actual, extent of the injury is, the better for him. The CT will give us a lot of information about what to do, and I've already pre-warned some of our orthopaedic guys who are our neck specialists about you. So we'll hopefully get you a bit more information as soon as possible.
Right.
Do you have any questions?
No, not really, Billy.
Okay.
Do you want a warming blanket on him?
Yeah, if he's cold, sure.
It's 35.4.
Yes, that'd be wonderful. I'm really worried that this will be a bad outcome, but I'm always hopeful.
I'm going to put a heated blanket on you, okay?
I've learnt over the years that people amaze me and surprise me in all sorts of ways. Now, if we can start packing him up,
Yep.
CT are happy we can go around.
Okay.
It's nice to have hope, but we need to also prepare for the worst here. Ready, set, go. Okay. Ready, set, go.
In Royal Melbourne Emergency, 71-year-old George is being moved into the CT scanner.
I'm going to come all the way across. Ready, set, go.
George has been paralysed from the neck down since he fell through a garage ceiling.
Well done. I'm really worried that the scan's going to show a high spinal injury and he won't recover effective use of any of his limbs. I worry then that he's going to be a quadriplegic. I'm worried that he's not going to be able to lead an independent life in any way resembling what he was doing before this accident.
A full scan takes up to 15 minutes, but the early results on George's high neck vertebrae, C1 to C4, are already in.
So far, we're not finding as much of a neck injury as we were worried about, so we're suspicious there might be a tiny little crack, but there's nothing obvious to really explain everything that's going on. So that's some good news.
The rest of George's CT scan shows no other injuries.
Normally when you break your spine, you break all the bones around it. With George, I can see a little crack at C3, but I can't see too many bony injuries going on in his neck. George? So CT so far looks surprisingly good.
That's good.
That is good news. But still not happy that you're having this much trouble with your arms and your legs. So we're going to go ahead and organise an MRI to see why is it so. Because I can see that you've got a 70-year-old neck, which is fair enough. So, it's a little bit more cramped for room. So we want to make sure that despite the bones looking good, that there's not an injury to just the nerve fibres themselves, okay? My concern with George, while the bone is intact, he's not got movement, and so that tells me that the spinal cord probably has some bruising and swelling around it, maybe some bleeding around it, and that's going to be what's producing all of his issues. And that's going to be the real question. How well does that recover over time? Unfortunately, the older we get, the less well we bounce back from these things.
When 21-year-old chippy Adam crashed his motorbike, he badly broke both his wrists.
It's okay. You're okay.
Once pulled back into position, Adam went to surgery where his bones were pinned and screwed in place.
They said, I think about 6 weeks I won't be able to lift anything too heavy.
Adam had kept his motorbike riding a secret from his parents.
I ended up telling them. I didn't want to be worried about me riding in the first place. I guess this is why, huh?
20-year-old law student Eleni had a major seizure in front of her shocked parents.
It's a horrible thing to have to watch their loved one go through, yeah.
She didn't know where she was.
Yeah.
She can't even remember.
Thankfully, her tests were clear. She was kept for observation and discharged later that day. 71-year-old George's fall through a ceiling left him quadriplegic. Unfortunately, George did not regain full movement. But miraculously, after weeks of rehab, he can now use his left hand and operate a wheelchair.
This is a guy that falls through a roof. By bad luck, there's a washing machine there. I mean, it's just those sliding door moments, just these individual moments, What if the washing machine had been put 50 centimetres over that way? What if, it's heartbreaking. And that's unfortunately part of the job. Part of our job is horrendously sad at times.
Okay, everyone, we've got a 61-year-old who's come off a horse.
Construction site manager Stephen's fall from his horse caused life-threatening internal bleeding.
This man has already had 4 units of blood. Steve, you've got a broken pelvis.
To save Stephen's life, doctors gave him 10 units of blood.
He's really critically unwell.
Surgeons repaired Stephen's arteries and screwed in plates to secure his pelvis. 6 days later, he's recovering on the ward.
No, it wasn't the horse's fault, really. They just shy sometimes, and that's what's happened, basically. I was thinking I might try and just bet on them rather than ride them.